Hello, my name is Duncan Locke. I am a nursing student at South Florida State College. I am in class Health, Wellness, Prevention Assessment, and Professor James is my teacher or professor. And this is my midterm video assessment. And I'm going to be assessing cardiac, respiratory. I am going to be educating and assessing for the different types of self-breast examinations and when to follow up with a OBGYN and what to be looking for. I'm also going to be doing a quick pain assessment upon approaching my patient. And speaking of which, my patient is Miss Chambers right here. She is going to be our patient for today. Miss Chambers, how are you today?
Good, how are you?
Fantastic. Are you in any pain right now? And can you give me a number on a scale of 0 to 10? 0 being no pain at all, and 10 being the worst pain of your life.
0 out of 10, no pain.
Okay, if she is in no pain right now, we are still going to be doing our assessment. I'm going to be starting with the cardiac assessment. Initially, I'm going to be visually looking at my patient. I'm going to be seeing if there's any bleeding, cuts, bruises, which I don't see any of right now. We are going to be assessing her skin integrity as well. With that being said, the patient's skin temperature is warm to the touch and within our normal limits. I'm going to be assessing her pulses as well. Her left radial pulse is at a +2, which I consider within normal limits as well. Strong pulse. It is not weak or thready. Same thing for her right pulse, her right radial pulse. It is at a +2, as we call it. It is not weak or thready. It is actually a good and strong pulse at a regular rhythm. And as well as her skin integrity as well. Her skin turgor, there's no tinting. She seems very well hydrated right now. I'm also going to be assessing the patient's dorsalis pedal pulses. And while I do that, I'm also going to be checking for any kind of edema or swelling, fluid retention at the patient's feet as well. So Ms. Chambers, may I see your right foot? So I see her right foot, and I'm assessing her pulses. And as of right now, I absolutely can feel that there is a +2 pulse. It is a strong pulse, and while I am looking at her, assessing her pulses, I can see that there's no swelling at her ankles, at her feet. She has no signs of edema, and also no signs of kind of fluid retention in this foot. May I see your left foot as well? So on the left dorsalis pedis, I'm going to be assessing her pulses as well. And right now I have a +2. That is a strong pulse. And I do not see any swelling at her ankles or feet or any signs of fluid retention. Speaking of fluid retention, I don't see any swelling on any other parts of her body, being the arms, face, neck, chest, anything like that area. With that being said, I also, Ms. Chambers, can you look up for me? So I do not notice any kind of jugular vein distension or JVD. And while she is, and now we are okay to use our stethoscope and auscultate her jugular veins. I am going to be using the bell of my stethoscope, and we're going to be listening for any kind of bruits or abnormalities in the neck, jugular vein areas. Can you look up, Ms. Chambers? Very normal, S1, S2. Normal, S1, S2, no signs of bruits. And now I'm going to be assessing the patient's heart. I'm going to be looking at the 4 different kinds of areas for her heart. We're going to be starting with the aortic valve or aortic area. We're going to be going to the tricuspid area, the pulmonary area, and then we'll be at the apex area of our heart, which is also the mitral area. And we'll be listening for heart sounds. All right, Ms. Chambers? Okay. At our aorta, we have an S1, S2 sound. Tricuspid area is at an S1, S2 sound as well. Pulmonary area, S1, S2, normal rhythm. And now we're at our apex / mitral area, S1, S2 as well. Cardiac assessment would say that everything is within normal limits. Auscultation is perfect. There's nothing visually wrong. The patient denies any kind of pain. Pulses are intact. Moving on, we are going to be going over to our respiratory assessment. I am going to begin by asking the patient if she's experiencing any shortness of breath, and then we will kind of move forward with our objective assessment of the patient. Ms. Chambers, are you feeling short of breath at all right now?
No, sir.
No shortness of breath on exertion or cough or nothing like that?
No.
Patient denies any kind of pain or shortness of breath, cough, fever, chills, anything like that. That being said, I am observing the patient. Her respirations are even, unlabored, and she has a normal symmetry of her chest rise and fall. I don't notice any kind of bruising or ecchymosis on her chest area. So I'm going to also assess the patient's lung sounds and make sure that her lungs are clear. All right, Ms. Chambers, can you just lean forward a little bit for me, and we will just listen to your lungs. Deep breath. Our left upper lobe of the lung is clear. Right upper lobe of the lung is clear as well. Deep breath. Our left middle lobe of the lung is clear. Our right middle lobe of the lung is clear. And take another deep breath for me. And our right lower lobe of the lung is clear as well. Lung sounds are normal and unlabored. Lungs are clear. All lung sounds are clear. The patient denies any kind of shortness of breath. And then also upon assessment, we notice that there is no tracheal deviation, no coughs, wheezing, anything like that of the patient. The patient is on room air, and that would conclude our respiratory assessment. Now I'm going to educate the patient on appropriate self-breast examinations. So, Ms. Chambers, when you do a breast examination, it is important that you do it at least once a month. A lot of times, to help people remember, we just tell them to do it on the day of their birthday every month. So your birthday is April 9th. So if you want to do your breast assessment on the 9th of every month, that is normally a good way to remember. The best times to do it can be in the shower, or sometimes women do like to do it while lying down. An appropriate way to do the appropriate breast assessment is lift your arm up. If you're going to be assessing your right breast, you can lift your right arm up, take this hand, your opposite hand, and use the 3 beds of your fingertips. Use these 3 middle fingers and use the padding of your fingertips and place them on your nipple. And the first way to assess would be to rotate it in a circular motion. And the second way would be to spread the fingers out, and that like so. And then the third way would be to go up or down on the breast. And when we do these assessments, it is very important to look for or feel for any kind of lumps, or I don't want to say masses, but pretty much just lumps or abnormal feelings or hard kind of lumps in your breast region. You should always follow up with a OBGYN and to be examined as well. However, if you do feel any abnormal kind of lump, bruising, or anything like that in your breast, it is very important to notify your OBGYN and usually get scheduled for a mammogram. Normally, if a mammogram does notice that there is some kind of mass or abnormal finding in that test, you can be followed up and do an ultrasound. And then after an ultrasound of the breast, if it feels like that there is some kind of mass or lump, we need to find out if it is cancerous or it's a tumor or a mass, and that would sometimes require a biopsy of some kind. It is very important to know that self-exam breast examinations are not the only way to assess your breast for any kind of breast cancer type lumps. You must always follow up with an OBGYN, and there you go. I am going to also educate Miss Chambers right now on the importance of adequate hydration. It's very important that in the hot Florida weather that we stay hydrated, and we don't want to put the patient at risk for dehydration or collapse of any kind. We are also going to, Miss Chambers is a teacher of second grade as well. So she is on her feet very regularly, and to prevent any kind of swelling or edema from just standing for too long, we could recommend that the patient may wear compression socks just to keep any kind of swelling down. However, not always necessary. It's more of just kind of a preference, or more just what she would prefer. We can also recommend that the patient does dieting and exercise. Miss Pageant does diet and exercise, but we always do like to just let the patient know if they ever come in for any kind of cardiac, respiratory, anything like that. We would always recommend to limit alcohol intake as well as have a appropriate diet. And I include this in every single one of my assessments and discharge plannings as well. We always want to recommend that the patient does not smoke or never does smoke. This includes marijuana, vaping, tobacco, whether it's cigarettes, cigars, anything like that. Ms. Chambers does not smoke to begin with, so we have gotten ahead of that one. And we also recommend that the patient also sees their primary care provider at least once a year. And Ms. Chambers, do you have any questions for me, comments, concerns, anything like that?
No, not at all.
Well, there you have it. She has been discharged, and we will see her again. Thank you.